first scenario, a 32-year-old professional skateboarder developed a DVT while on a long airplane trip. He started heparin while in the hospital, but is now being discharged and switching to oral warfarin. Warfarin is an anticoagulant that interferes with the synthesis of vitamin K-dependent clotting factors. While on warfarin, the patient must not drastically change the amount of vitamin K-rich foods that they consume. Inconsistent levels of vitamin K can make warfarin ineffective, and vitamin K is actually the antidote for warfarin toxicity. Frequent INR monitoring is required to titrate the warfarin dose to within the effective range. This is usually done every few days until a therapeutic INR has been achieved, and then less frequently after that. Our priority education with this patient is going to be about his increased risk of bleeding from anticoagulant therapy. Patients must be counseled regarding the importance of safety during therapy. Contact sports must be avoided, extra care must be taken with oral hygiene, and electric razors must be used. We will also emphasize the importance of regular INR testing. This testing is generally done every few days at first, but less frequently once the desired drug levels have been achieved. We will teach the patient to recognize the signs and symptoms of bleeding, particularly from the gums, nosebleeds, and GI bleeding, and know when to report it. Patients must also avoid drug-drug and drug-food interactions that can increase bleeding risk, especially in regard to foods containing vitamin K. Alcohol should not be taken by patients on warfarin. This patient also takes ibuprofen, which is an NSAID, and ranitidine, an H2 blocker. Both of these drugs have significant interactions with warfarin, so we will assess the situation in more detail during the scenario.
Hi Yanni, it's good to see you again. I'm just here to kind of go over some discharge planning with you. I know that your doctor just came in to see you, and you probably got a lot of questions because it's a lot of information. So if you have anything to ask, please.
Yeah, so I guess I know I'm going to be on a blood thinner, but does that mean I have to stop skateboarding?
So
Skateboarding is my livelihood. I can't stop.
I completely understand.
For life.
I completely understand, sir.
Skateboarding is my life!
So the drug that you'll be on is actually not technically a blood thinner. What it is it's warfarin, and what it does is that it allows extra time for your blood to clot, so that you'll be less susceptible to developing another blood clot, which will decrease the chance of a DVT. And in regard to skateboarding, we do encourage that you avoid it just because you'll be prone to injuries, which can lead to uncontrolled bleeding, and we don't want that.
Okay, yeah, I guess I should be okay if it's just for 6 months. After that, can I get back out there before?
Of course, you can skateboard and you won't be at risk for another blood clot if you continue your warfarin for the 6 months that we have planned. And I do know that skateboarding is your source of income. Do you have any support for those next few months?
Yeah, we'll manage. We'll be okay. My wife works, so it should be fine.
Okay, good. And we're not saying you need to quit physical activity altogether. We do encourage that you get physical activity, just kind of like moderate exercise such as walking or swimming, nothing contact sports, so don't get slammed by buff men or anything. We do want to avoid anything else that could cause bleeding, so use, toothbrushes with soft bristles. If you don't already, shave with an electric razor. We do encourage you to decrease your alcohol use if you do use alcohol. And we do want you to avoid knives. Okay, not avoid knives, but be careful around knives.
Be careful around knives.
Be careful around knives, okay?
So exercising won't put me at risk for getting another blood clot?
Absolutely not. The reason why you developed the DVT is because you were kind of just sedentary for so long on that plane ride. So as long as you just keep it mobile, if you're on another plane ride again, walk up and down the aisle. If you're on a road trip, take a pit stop, do some walking, get back on the road.
Okay, so I just need to remember to keep moving. If I'm sitting for a long time, I gotta take little breaks to walk around.
Please walk around.
Okay.
Okay. In addition to activity and stuff, we do want you to notify your healthcare provider about any medications you'll be taking, herbal supplements. Try not to exclude any of that information if you're going into a procedure, because warfarin does interact with a lot of drugs, and that could also increase some bleedings. Make sure you get plenty of fluids and fiber in your diet, because we don't want any rectal bleeding, because this drug can cause that.
Ooh, that doesn't sound good. Should I call my doctor if that ever happens?
Yes, you definitely want to know if you have excessive bleeding, especially in the rectum area, also in your gums, and that's why we emphasize the use of soft bristles. If you have any nosebleeds, that's a big warning sign as well, because you might not be able to clot in time. So call us if that happens as well.
How are you guys gonna make sure my blood doesn't get too thin? Are there tests you can run for that?
Yes, that is exactly what the INR testing is going to do. It's going to measure the time your blood takes to clot. And while you're on therapy, we want the range to be between 2.0 to 3.0. So, and I know that it could be a hassle coming in to get those blood tests done, but to make sure that your warfarin therapy is working and you're able to get back on track, we want to make sure you come in and get those done on time.
Okay, I'll make sure to schedule those appointments. This sounds really important.
It's very important.
Okay. Okay, so is there anything else I should know?
Yes, like I said before, let your providers know that you're on warfarin therapy so that it doesn't interfere with any care procedures. And it is a great idea to use your medical alert function on your phone and keep a medical card on you, implicating that you're on warfarin.
Okay, so I have the app on my phone. I'll be sure to add warfarin to it.
Please do, please do. So I'm also looking at your list of medications here, and I have some questions for you. I see that you're taking ibuprofen, but it's not indicated why. So what is it that you're taking it for, and is it a prescription?
No, I just take it. I'm a skateboarder, so I get bumps and bruises, so I take it to ease the pain a little bit.
And how many times do you take it a day?
So I take probably a couple the 200 milligrams, maybe 3 times a day.
3 times a day?
Yeah,
okay.
Most days.
Most days, not every day.
Not every day, but most days.
Okay. Well, while you're on this warfarin therapy, NSAIDs like ibuprofen, even aspirin, actually increases your chances of bleeding. So while you're on therapy, we do recommend that if you're having aches and sores, maybe switch over to Tylenol to relieve that, because there's no effects on the platelet aggregation there. If you're having aches and sores, is there anything else that has helped it in the past? Maybe cold compresses or warm towels or anything?
Well, I used to get massages. That was helpful.
Wow, okay. Okay, so maybe we try to incorporate more massages.
Okay.
If you're able to, and maybe cold packs.
Cold packs? Okay, yeah, I've done that too. That seems to help
Good.
too.
Yeah,
Okay.
we don't want too much medications in your body right now, okay? And also says that you're taking ranitidine for your heartburn. Unfortunately, yeah, there is an interaction between warfarin and ranitidine. Ranitidine will actually increase the effects of warfarin.
Oh, so will that make it even more likely that I'll bleed?
That's right. Your doctor will probably recommend that you stop taking it altogether. And I do suspect that you have the heartburn due to your intake of so much ibuprofen a day.
No way, is that a side effect of ibuprofen?
That's the side. It could be a side effect. NSAIDs like ibuprofen can cause a lot of GI problems, including gastric reflux, and I think it might be contributing there. So now that you're going to stop the ibuprofen, why don't you see if the heartburn decreases? And if it actually worsens or is still there, call your provider and he can recommend something that's more compatible while you're on warfarin.
Okay, that sounds good.
Yeah, okay. And I think that about covers everything. Do you have any more questions for me?
No, I think I understand. I'll stop taking the ibuprofen and ranitidine now, and I'll be sure to go in for my INR tests. I'll be extra careful to avoid injury while I'm on the warfarin, and I'll have to stop skateboarding until I don't need to be on the warfarin anymore, and I won't change the amount of leafy veggies I eat.
And what can you do in the future to prevent more DVTs from occurring?
Oh yeah, so if I'm ever on a long plane ride, I need to make sure to get up and walk up and down the aisles, maybe every hour or so, and then on like long car rides, make sure we take pit stops, and I can't sit in front of the TV and play video games all day without taking little breaks and walking around the house.
Perfect.
So, is that good?
Perfect. Yeah, it sounds like you understand everything we covered. And if there's any more questions or anything I didn't answer, here's a handout for you.
Thank you.
Yes. And you call us if you have any concerns or if you have bleeding, okay?
Okay, I'll call for bleeding.
Okay. Thank you, Yanni.
Yep.